Tonight, a big move for one of Minnesota's biggest healthcare systems. Allina Health says it will soon be acquired by California-based nonprofit Sutter Health. Raya Katene has a look at what this might mean for patients and staff.
Yeah, well, Allina Health says its name will stay the same and its headquarters will also still remain in Minneapolis. But the combined footprint of the two organizations would include 88,000 staff members serving more than 5 million people. And some say that could be cause for concern.
At one of Minnesota's largest healthcare providers, people constantly come and go.
I like to work with people. I think it's, for a lot of us, me included, it's really a dream job.
Dr. Matt Hoffman's job is caring for people as a family doctor at Allina Health. But he says with growing challenges like burnout from administrative workloads and less time with patients, he's now a leader of Doctors Council under SEIU, the union representing thousands of Allina's healthcare workers.
It's never fun to get called into a meeting 5 minutes ahead of time and get told your company's being acquired, especially when you're trying to care for patients under limited resources already.
On Tuesday, California-based Sutter Health announced its plans to acquire Allina to serve as its Upper Midwest division. In a joint statement, the two nonprofit healthcare systems say they will combine resources to expand specialty institutes, use AI to reduce administrative tasks for caregivers, and improve patient access and affordability.
Decades of research has shown in economics is that these types of mergers likely don't improve quality for patients at all, but one thing we do know with pretty good certainty is that they raise costs.
Associate Professor Saye Nikpay is a healthcare policy and economics researcher at the University of Minnesota. She says cross-market mergers involve healthcare systems in different areas joining together, allowing them to combine their influence when negotiating reimbursement rates with insurers. But bigger influence means more leverage, often leading to higher prices for patients.
All hospitals have been going through a period of turmoil, and that is because we are going through a seismic shift in healthcare financing right now.
Nikpay says broader financial pressures like changes to Medicaid are creating uncertainty for healthcare providers. As Hoffman says, uncertainty lies ahead for him and his colleagues.
Concern about what this looks like, certainly for our jobs, our colleagues' jobs, the other healthcare workers' jobs, but also our patients. What does this mean for our patients? What does this look like for healthcare in Minnesota in general?
Now, in a statement, Allina did emphasize that this deal is not a merger. They said the final structure still has to be defined in an agreement that would have to be reviewed by regulators. I did also reach out to both Allina and Sutter Health for interviews today. We did not get that response, Julie.
All right. Thank you, Raya.